Hey guys, sorry for the shaking if you can see that. My camera is on a little tripod right now and it kind of shakes when I push the button, so sorry about that. Anyways, I wanted to show you these flashcards that I recently got. I found these on Mercari. I was looking at different things to like help me prepare for medical school and different study things, and I found these flashcards and they were only $8, and so I got them. These are actually for medical students, but I think it's never too early to start studying something that you know you're going to eventually have to study anyway, even if it's just to like introduce different concepts or information to you. So anyways, these are farm cards, as you can see, and these are pharmacology flashcards, but they are like very in-depth. So I don't know if this would help like nursing students too, but I was thinking like at some point I could go over some of these cards with you, but I want to show you what the cards actually look like. So we will look at, hold on, let me find something. Okay, cephalosporins, since I'm allergic to cephalosporins. So here we go. We have cephalosporins, and so it gives all this information. It talks about, you can see up here, it has cephalosporins. It tells you that it's an antibacterial, and then it has like the mechanism, so how it works. Like it says, these drugs bind to and inhibit transpeptidases, which catalyze the cross-linking of peptidoglycans in the final step of bacterial cell wall synthesis. Relatively resistant to most, but not all, beta-lactamases, divided into different generations, and it has it on the back, what the generations are. But then it also talks about different resistances that it may have, and it talks about like clinical uses. For example, first generation, excellent activity against gram-positives such as staph and strep, some activity against gram-negatives, uses, surgical prophylaxis and cellulitis. Or third generation, very broad gram-negative coverage efficiently across BBB. Some agents include excellent coverage of Pseudomonas, but also exhibit reduced activity against gram-positives, uses, meningitis, and sepsis. And then it talks about like side effects, allergic reactions, and information like that. So these are definitely helpful for somebody who's in medical school, just to get used to the information. Like I said, I don't know if this would necessarily help nursing students, but I figured like if you guys are interested more, like you want more information about these, I was thinking like we could go over some of these in more depth. So this talks about like the different generations. I don't know how well you can see that. And it gives a whole bunch of information. It talks about like the different routes and the different medications that are under the cephalosporin like name. So like, for example, IV cephalosporins. So the first generation would be Ancef. Third generation would be ceftriaxone or Rocephin, just so you can see that. But let me know if you guys would be interested in seeing more information about these, and I can go over, because I have like a whole bunch. There's like 250 or more than 250 different cards in this. So just let me know. I know this was a super short video, but I just wanted to kind of let you guys know that I have these, and I have a bunch of different ones. As you can see, I just pulled a whole handful out of the box, but if you guys would like to go over some and learn more about different medications, please let me know. Like they have influenza antivirals, they have Dilantin, which is an anti-seizure medicine, Tegretol, which is a seizure medicine, Topamax, which is the seizure medicine that I was actually on. So just let me know if you guys would be interested in that. If not, that's okay. I just thought that I would tell you guys about it. And like I said, I found these on Mercari. So if you guys are looking for like flashcards for school, or anything like that, definitely check out Mercari, because that's where I also found those MCAT flashcards that I have shown you guys like previously. So don't be afraid to look on there for different things. But as you can see, this is a pretty big box of pharmacology flashcards, and it goes really in depth, so it's good for medical students. But also I think it would be good for nursing students or anybody who gives medicine to a patient, so then at least you know like what it's doing to the person's body and like what the uses are and what potential side effects are and things like that. So anyways, just let me know if you guys would be interested, and I can make other videos going more in depth with specific cards. So with that being said, that's all for today's video. I hope you guys enjoyed, and I will talk to you guys next time.